Support comes from the Missouri Forest Products Association, honoring Arbor Day on April 26th, with an ongoing commitment to sustainable stewardship and conservation of Missouri's forests. ChooseWood.com.
From St. Louis Public Radio. This is St. Louis on the Air.
I'm Sarah Fensky. It's been one of the most cited statistics in St. Louis this past decade. There's an 18-year gap in life expectancy for people who live in Clayton versus people who live in North St. Louis. The two zip codes are just a few miles apart, but offer very different life experiences. Jason Purnell was one of the authors of the report where that statistic originated, and now he hopes to be part of the solution. Purnell is the Vice President of Community Health Improvement at BJC Healthcare, and yesterday the local healthcare behemoth unveiled a strategic plan that aims to decrease health disparities between the region's richest and poorest residents, and he joins us today to tell us all about it. Jason Purnell, welcome.
Thank you very much, Sarah. It's great to be with you.
So, Jason, you were a principal investigator for that For the Sake of All report. How did the findings in that report shape this community health plan?
Well, you know, there's a direct through line from that research, and what we said were some of the recommendations, which included creating economic opportunity for folks in our community, focusing on education, investing in mental health and quality neighborhoods. So we've never stopped doing that work. We were certainly working on implementation as a team through Health Equity Works, and this is an exciting opportunity to amplify that work. So
this is kind of 8 years after that report. A lot of time has passed. There's been a lot of attention paid to these issues in St. Louis. Do you think we're at a point where we're ready to take it to the next level? Or are we still on first base?
No, I tell people I'm the most hopeful that I've been in that last 8 years, in part because we have had so much awareness, and not just because less than 3 months after this report was released, Michael Brown was shot and killed in Ferguson. And of course, St. Louis becomes the international epicenter of the Black Lives Matter movement. But more recently, we've seen disparities uncovered by this global pandemic. We've seen the international attention after the murder of George Floyd. And I'm seeing institutional actors like BJC and others making serious commitments to change.
So let's talk about what BJC is doing here in particular. I feel like community health improvement, these again are kind of the buzzwords that St. Louis has been working on for the last 8 years here. What do you see as sort of the big important parts of this plan?
Well, I talk about 3 pillars in terms of how we're actually going to advance health equity, and those include BJC's role as an anchor institution, which means thinking seriously about our role as an employer, a purchaser of goods and services, and an investor in our community. The second pillar is around partnership and collaboration, which means we can't create solutions in our offices. They have to be informed by the lived experiences of people who are dealing with these inequities every day, and we have to work with other partners in our community. St. Louis can be a very fragmented and siloed place, and we have to better coordinate our activities. And the third pillar is policy. So that's what that was the framework that guided our planning, and it was an inclusive planning process. We understand we can't improve community health without the community. So we had over 200 stakeholders who were part of this planning process, and that was internal and external stakeholders. And 4 focus areas, the anchor strategy, diabetes and healthy food access, infant and maternal health, and school health and wellness are where we're focusing.
So those are some big areas you're focusing on. I mean, this is like no less than like all the most important things in life. How can a hospital group, even one as big and as prominent as BJC, begin to deal with all of that?
Well, we lean into what it is we do. One of the really compelling things about the anchor strategy is it's not asking BJC to become a social service agency. It's saying how in the course of doing business can we accrue benefit to the community? How can we focus our efforts around hiring and purchasing and leveraging our balance sheet to create economic opportunity in places that have faced disinvestment for decades, and we're already beginning to do that work. Also, how do we look at things like the pilot that is happening at Christian Hospital around healthy food access for those who are food insecure or financially insecure and have uncontrolled diabetes? How do we create hubs within the community for behavioral health and integrate doulas into the clinical care teams, particularly for Black moms, where we know that kind of continuous support leads to better birth outcomes. Mm-hmm. So those are the places where we're starting. And this is a start. So this is a 2-year plan, but this is permanent infrastructure within BJC. There is a department that I lead called Community Health Improvement. So I sometimes push back against the notion that this is an initiative or a program or a project. Mm-hmm. This is the work of BJC.
So then why call it a 2-year plan if this is, the permanent staffing is there? Is this you're going to reevaluate it in 2 years?
Absolutely.
See if this is the best use of all of these resources.
Yes. We've got to have specific goals and benchmarks that we're working towards. And part of the direction we got from our excellent CEO, Rich Leikwig, was we're not planning for 5 years because we may need to pivot before 5 years. We're going to need to learn from our experiences and improve upon them.
So you're working with a lot of existing community groups and, in some cases banks, people who are already doing these things. Is what BJC contributing in a lot of these cases money?
That is one of the roles that we can play. We were very explicit in our planning process that there are multiple roles that BJC plays. We are a nonprofit health system. We're not a charitable foundation, but there are ways that we can leverage our balance sheet. There are ways in which we're partnering with the various hospital foundations. And there are resources to be brought to bear that include human resources and partnerships and relationships as well.
So you had mentioned Christian Hospital. This is in North St. Louis County, and I understand a lot of these programs are going to run through there.
Well, Christian is certainly part of the geographic focus. North St. Louis County and the city of St. Louis are where we're going to start our efforts.
And so how will this work? I mean, people are coming to get the health care they need at Christian Hospital. That's when they're sort of engaging with this system and go down this path with you?
For that pilot that we've unveiled at Christian Hospital, that's certainly how people are identified, usually either through the emergency room or inpatient, and screened for food insecurity. That's one of the things we also want to standardize across the system, no matter what hospital or healthcare setting you encounter. Mm-hmm. Are we screening people for things like food insecurity in a standardized way and have a standardized method for responding to that food insecurity?
So they might come in with, say, a broken leg, something totally unrelated to nutrition, but you're going to use that moment to be like, what else can we help you with here?
Absolutely. And this is, it can be a scary term for some folks and seem complicated. We call this the social determinants of health, which is simply saying that there are factors beyond healthcare, several of them, and they're quite crucial factors that actually determine our health outcomes. And they include things like access to healthy food, but also a job, a safe place to live, educational attainment. All of these are social determinants. And by asking those questions, we can better prepare people for healthy lives.
And yet, what's happening at Christian Hospital? You say that's one pilot that you're supporting. That's only one small part of this. So how are other people that you're going to help through this program, how are they sort of getting engaged with this, what you're setting up?
So it's not simply, and not even principally, medical care that we're talking about when we talk about community health improvement. It truly is. We're looking at how do we partner with community-based organizations, for instance, in the food ecosystem of communities where there isn't always access to fresh fruits and vegetables. How do we help support those organizations?
So that they can just serve more people living in those areas.
Absolutely.
So not targeted at people who are necessarily using BJC for healthcare, just anybody living there.
Absolutely.
Okay.
Absolutely. because that's the only way we're going to make community level impact.
Yeah, so that's one example of that, just supporting people doing that food stuff. How about like when we're talking about, I don't know, some of these other partnerships, like how will that play out then? Again, it's just BJC sort of supporting what they're doing so they can keep doing the work they're already doing.
Well, I can give you a very clear example in the banking relationships that we've announced, where we've said that we're making significant deposits into financial institutions, Midwest Bank Center, and the St. Louis Community Credit Union. That is very upstream social determinant work to change the social and economic context of community. We expect that those deposits will be lent for small business creation and growth, for real estate lending, for personal loans in places where it's very difficult to get access to capital, and it has been for decades.
We're talking today to Jason Purnell. He's BJC's Vice President of Community Health Improvement. BJC Healthcare yesterday unveiled a very big plan to try to deal with community health. We do need to take a quick break here, but we'll be back shortly to continue this conversation with Jason. We'll also hear from one of the partners in this effort, specifically dig into that whole banking issue and how that fits into this work. This is St. Louis on the Air on St. Louis Public Radio.
Support comes from the Missouri Forest Products Association, honoring Arbor Day on April 26th, with an ongoing commitment to sustainable stewardship and conservation of Missouri's forests. ChooseWood.com.
And now back to our conversation. Again, we're talking about BJC's new community health plan. And our guest today is Jason Purnell. He's the Vice President of Community Health Improvement, one of the people behind this. There's a whole lot of people behind this, Jason. It sounds like just getting everybody in the same room on the same page. This must have been a multi-year effort.
Well, it took us about 8 months to complete the plan, and we did it all virtually. So, of course, we're doing it in the middle of a pandemic. So these were Teams calls, multiple of them.
Everything gets a little bit harder.
Yes.
So one of the partners in this is the St. Louis Community Credit Union. And we were just discussing before the break their role in this, how this is working. So the idea is that to funnel investment into under-resourced communities, BJC is going to work with St. Louis Community Credit Union to give small business and mortgage loans. Here's Alex Fenoy. He's the credit union's vice president and head of business services.
We are very excited and honored to partner with BJC in this work. This is who we are as an organization and have been for 80 years already. And for them to see that and want to support us to grow and have a larger reach and be able to be more of a positive catalyst to positive change and evolution in the St. Louis community is exciting. And we look forward to having hundreds, if not thousands, of business members that take advantage of this partnership.
And that is Alex Fenoy. He's with the St. Louis Community Credit Union as its vice president and head of business services. So, Jason, BJC is basically putting money into the credit union, and the idea is then they would lend it to people who might not otherwise qualify, or this would just increase the amount they're capable of lending?
It increases, it allows them to initiate a small business lending program. They didn't have small business lending as part of their portfolio before. So it's increasing the access to capital for people who very often do not have access to capital. You know, small businesses were hurt quite badly by the pandemic, and Black-owned businesses hurt even more. And one of the things that Black business owners note was not just that they they weren't at the head of the line for the PPP loans, but just traditional.
Statistics have proven that out.
Yeah.
A lot of them got shafted.
Traditional bank loans, even before the pandemic, were harder to get. So this opens that door of opportunity.
And am I understanding this right, that already some of those loans have been issued? Yes. I mean, you guys just announced this yesterday, but parts of it are already kind of up and moving at this point.
Yes, I would say our anchor strategy work is the furthest along of all the parts of the plan, and we're incredibly excited to be partnering with both them and Midwest Bank Center.
So how big of a financial commitment are we talking about for this plan as a whole for BJC?
Well, I'm not at liberty to share, departmental budgets and numbers like that, but I can say that, there's a substantial commitment to building out a new department, and that includes, staff and all the resources that go with that. And as I mentioned, we're partnering as well with our hospital foundations, both the Christian Hospital Foundation, the Missouri Baptist Foundation, for instance, supported the pilot at Christian Hospital around diabetes and healthy food access. So this is a serious commitment, both mission-wise and financially, to this effort.
And so the press release announcing this, it referred to these as the first partnerships. Are you in the process of recruiting additional partnerships?
Absolutely. And not just in our anchor space, but in the work around infant and maternal health. We're talking to community-based doulas around how we intentionally and authentically and equitably partner with community-based doulas who have such wisdom in terms of supporting moms and babies. We're also looking at partners in the school health space, particularly around behavioral health in the school health space. We know that children have suffered greatly during this pandemic. We're seeing suicide rates skyrocketing among younger and younger people in our community and across the nation. So we have significant work to do, and we understand BJC cannot do this work alone. And very often it's following, not leading, amplifying and championing things that are happening on the ground and could have greater impact with greater visibility and support.
It's interesting to hear you talk about that the importance of championing people already doing this work. I know Mercy, a different hospital chain, they kind of stepped it in a little bit on the doula front. They wanted to partner with this amazing doula organization doing work in North County. And it ended up feeling to that organization, the Jama Birth Village, that they were not respected, that Mercy was just kind of trying to use their resources. BJC is even bigger than Mercy. How do you make sure you're not subsuming some of these smaller organizations? You want to work with them, you want to support them, but it's got to be hard to, not overstep.
Well, this is why it is absolutely at the center of everything that we're doing. I have a director. Her name is Danisha Bohannon. She is our Director of Partnerships and Collaboration. She comes to BJC from the Missouri Foundation for Health. She lives in North St. Louis. Everything we do has to be informed by people on the ground living this experience. And we have to have dedicated infrastructure, and we are building that infrastructure for not just having token voices at the table, but having real involvement. So in the case of working with doulas, just showing up with humility in those conversations and knowing that we're going to have to work to build trust and that's going to take time. But we cannot do anything to or for the community. We have to do with the community, and that means showing up with some humility.
So you've talked about this as being a long-term commitment, but also a 2-year plan, and that there might be some pivots that are made at the end of that 2 years. In our final minute or so here, how will you judge success for these first 2 years and everything that's now underway? There's so much in this plan. It seems very complicated to figure out, is it working and is it working fast enough?
Well, I think we have to be realistic around the fact that these disparities took decades to solidify, and we're not going to change them overnight. But we can make incremental progress towards some goals, and we're going to have very clear metrics that help us to understand, for instance, how much resources flowing into community, what kinds of changes are we seeing in terms of people's outcomes with respect to diabetes, and what kind of new access is there to the resources that people need.
Well, it's been great to hear about this program. I'm sure we'll be talking more about this as it continues. Jason Purnell, thank you for joining us today.
Thank you, Sarah.
And Jason is BJC's Vice President of Community Health Improvement. You can learn more about this initiative. We have a story on our website. That's stlpr.org. This episode was produced by Kayla Drake with audio engineering and podcast design by Aaron Dorr. Our executive producer is Alex Hoyer. St. Louis on the Air is a production of St. Louis Public Radio. Understanding starts here. If you learned something new from today's episode, consider leaving us a review and rating on Apple Podcasts on the App Store. It's the easiest way to help people discover our show. We appreciate it. Thank you. St. Louis Public Radio is a member-supported service of the University of Missouri, St. Louis.
Support comes from the Missouri Forest Products Association, honoring Arbor Day on April 26th with an ongoing commitment to sustainable stewardship and conservation of Missouri's forests. ChooseWood.com.